In terms of comorbidity, so we see in terms of comorbid disorders alongside ADHD, 1/2 of individuals diagnosed with the combined inattentive and hyperactive impulsive type will also get a diagnosis of ODD, which is oppositional defiant disorder. 1/4 of the inattentive type will get an oppositional defiant disorder diagnosis, and that's a disorder we'll be talking more about, but marked by defiance. Conduct disorder is a more severe disorder than ODD, where there's greater levels of hostility and aggression along with the defiance, and so there is some comorbidity with ADHD there as well. 15 to 40% of individuals with ADHD will also have a specific learning disability. There's comorbidity that's pretty high with mood disorders. 25 to 30% will also have major depression. 10 to 20% will also have bipolar disorder. Anxiety disorders, we see 25 to 35% of individuals with ADHD also getting a diagnosis of an anxiety disorder. Tic disorders, language disorder, obsessive compulsive disorder, and also autism spectrum disorder make the list of comorbid mental disorders. There's some interesting work related to substance abuse. If there is going to be overlap with substance abuse, the most commonly abused substances are first and foremost marijuana, and then secondly alcohol. Interestingly, there was a fear that prescribing stimulants to individuals with ADHD could lead to them using those stimulants for recreational purposes, but it's actually the opposite. Stimulant treatment seems to reduce the likelihood of later substance abuse. So that's interesting. All right, and 2 more here, a little bit on the developmental course. Okay, so Cantwell in 1996 discusses 3 kinds of outcomes or trajectories for the overall developmental course of ADHD. So in 30% of cases, roughly, we see this pattern of developmental delay. And in 40% we see continual display, and in 30% we see developmental decay. So developmental delay is the instance where children may seem to outgrow some of the symptoms of ADHD as they move into adolescence and adulthood. So they sort of catch up and get on track. In 40%, you see the continual display from childhood through adolescence and through adulthood, still struggling with the symptoms. And developmental decay is that those symptoms are continuing, but then you see the emergence of an additional mental disorder or other psychopathology as you move later into childhood, adolescence, and adulthood. So what do we see in early childhood with individuals who go on to get an ADHD diagnosis? Sometimes we see excessive activity, difficult temperament, poor sleeping patterns, poor inhibition, inattention in preschool. And the school age time period is known as the provoking factor. It's often, specifically in entering 4th grade and in entering 7th grade, there are significant ratcheting up that takes place in school where suddenly the homework gets harder, the projects get harder, the time management demands of school, maybe having multiple teachers with multiple assignments that you need to keep track of. Everything just gets much more complex, specifically at those 2 jumps, 4th grade and 7th grade. And so in general, the school age time period is thought to be a time period that sort of provokes and really challenges individuals with ADHD. And so that's why we see the symptoms emerging most commonly then, and that's also when we see the diagnosis happening most frequently. There are many, many trajectories described both in your book, in the DSM, and other texts that I've consulted. So just keep that in mind. It's not as simple as me giving you kind of 2 or 3 different trajectories. There's many, many different courses and presentations of ADHD. So there is one group of research that suggests that the inattention symptoms and the impulsivity are most likely to remain and be the most stable throughout the lifespan. While hyperactivity may be having the greatest likelihood of actually declining over the lifespan. But then there are other people who say, well, the outward hyperactivity, the jumping and the climbing and all of that might actually decline, but it just changes itself qualitatively into sort of an internal restlessness throughout the lifespan. Just a little bit, I ran out of room here, but some associated difficulties with an ADHD diagnosis. Individuals with ADHD are thought to be more accident prone than someone without ADHD. This also shows up in things like automobile accidents, which may not be surprising when you think about impulsivity, distractibility, inattention, which obviously attention many executive functions and being able to maintain your focus are critically important when driving. But it also see an increase in additional types of accidents as well. We see academic difficulties, difficult relationships with teachers sometimes. Of course, there's an impact on the family as well. Parents often feel that they have to do a lot of direct supervision of a child with ADHD, especially someone who's impulsive and accident prone. We also see more conflict between siblings and also between the parents and the child with ADHD, greater conflict. Social dysfunction, 50% of children with ADHD experience peer rejection, and that's especially in that impulsive hyperactive category. The children who have the inattentive aspects or type of ADHD may be more neglected or ignored as opposed to outwardly rejected. But you could imagine how impulsive behaviors could cause some conflict with peers. And then we also see problems with sleep that tend to persist and be an associated difficulty of having that ADHD diagnosis. And lastly, a little bit here about etiology. And I cannot underscore enough sort of the complexity of ADHD in terms of etiology, developmental course, risk factors. It's just a very complex disorder. So I'm trying my best to summarize without losing some of that complexity. So in terms of nature-nurture, right? From the nature perspective, in terms of genes, ADHD is thought to be very highly inherited, right? High heritability. 40 to 60% of kids of parents with ADHD will also go on to have ADHD. It's thought to come from a polygenic model, right? So multiple genes interacting to create the outcome of ADHD. Also seen polygenetic is not surprising given the high comorbidity of ADHD with other disorders. In terms of heritability estimates, that's what we mean by the proportion of the ADHD that's accounted for by genetic factors, right? So for inattention, 71% of inattention is accounted for by genetic factors. 73% of hyperactivity and impulsivity is accounted for by genetic factors. In terms of physiology, we think of ADHD being linked to a variety of central nervous system dysfunctions, everything from neurotransmitter problems, so specifically norepinephrine, serotonin, dopamine are specific neurotransmitters that have been a focus in ADHD research. A years-long delay in cortical maturation, so cerebral cortex, reduced brain volume, also differences in the appearance of the frontal lobes and the cerebellum, and I could really have pages all about sort of the central nervous system deficits and abnormalities that are seen in ADHD, but those are just some of them. In terms of prenatal or birth complications, being very low birth weight seems to be a risk factor. Also, exposure to maternal smoking and alcohol. In terms of psychological factors, we've already spoken about executive function deficits, but I'll mention them again. Also, temperament. Infants who show high reactivity or difficult temperament seem to be at greater risk. There's also something called a sluggish cognitive tempo. So this is, in other words, sort of someone who's a slow processor who might appear disoriented when you're trying to talk to them or when they're trying to process information. So there's some research on that sluggish cognitive tempo as being a predictor of ADHD. In terms of the family or the environment, we don't believe that the family can cause a child to have ADHD. It's more an issue of exacerbating the symptoms of ADHD and maintaining the presentation of ADHD. Work on exposure to lead. So children who have ADHD tend to have higher levels of lead in their blood. Stress and economic disadvantage, marital conflict, poor parenting are all things that can be in the family or home environment that can actually exacerbate the ADHD. So we'll talk more in class about treatment and a few other aspects of ADHD, but that's all for now.